Welcome everyone to our latest presentation here on Assistive Touch. This presentation was done by Michelle Womax as she goes over a full eye review as to optometry and ophthalmology and eye diseases. Thank you so much.
My name is Michelle Lomax, and I am a certified ophthalmic technician for Tufts Medical Center, also known as New England Eye Center. Starting off, I'm just going to talk about the different specialists within the optometry ophthalmology world. Sometimes it can get a little confusing. First, we're going to start with the ophthalmologist. So your ophthalmologists are your medical doctors. So they've gone to medical school. They've typically done a surgical rotation, and they typically specialize in one particular area of the eye. Specialties include just general ophthalmology. Usually these physicians have not done a fellowship into a particular subspecialty. There's the retina specialist, your cataract specialist, your cornea specialist, your neuro-ophthalmologist specialist, glaucoma specialist, uveitis, pediatric and strabismus specialists, and your oculoplastic specialists. So again, those will be your doctors that will that can perform surgery or procedures within the office. You also have optometrists. So they have gone to optometry school. So it's a graduate program. They are physicians, but they are not medical doctors. They perform the exact same eye exam as the ophthalmologist, but again, they cannot perform surgeries or major procedures in the office, such as lasers. At least in Massachusetts. Other parts of this country, optometrists can actually perform lasers and do some sort of treatment. In Massachusetts, optometrists are now actually able to monitor glaucoma and can prescribe glaucoma drops. But they really focus in on glasses and, just your eye health. And if they need to send you to an ophthalmologist for further care, they will. There's also orthoptists. So orthoptists complete a 2-year program, and they're muscle specialists. So they typically work alongside the pediatric and strabismus physicians to really help with the alignment of the eye. They prescribe prisms to put into your glasses if you have double vision. They also take pre-op measurements in regards if you need strabismus surgery. There's the ocularists. Ocularists specialize in eye prosthetics. There's a few here in Massachusetts. And then finally, there's your opticians. Your opticians is working at your glasses store. So they're the ones that make their glasses for you. They don't have any medical background. They do the glasses for you. Right. So the basic structure of the eye, and on this slide, I do have a photo of some of the anatomy of the eye, including the cornea, which is the transparent front layer of your eye. It helps focus the light. You have your pupil, which is the dark opening that controls light entry. You have your iris, which is the colored part of your eye, and it helps regulate your pupil size. The lens of the eye, it focuses the light into the retina. You have your retina, which converts light into neural signals. And you also have your optic nerve, which transmits signals to the brain. So the human eye is a very complex organ that is responsible for your vision. So understanding the structure of the eye helps in recognizing and understanding common eye diseases. You also have your vitreous chamber and your vitreous humor, which is actually what helps keep the eye inflated. It keeps its shape. So that is that big space that on diagrams that you might see between the lens and the retina and optic nerve. As you age, that vitreous it's a jelly when you're born. That jelly kind of starts to liquefy, and that that helps when it is a full jelly, it keeps your retina in place. So sometimes that starts to pull away and you start to see those floaters and flashing lights that I'm going to get into a little bit later on. But just to give you a little bit of the main structure of the eye. So first I'm going to start with the cornea and the lens. So the cornea, like I said, is the transparent dome shaped outer layer of the eye. It does most of the focusing by bending the light once the light enters the eye. It's also the first line of defense for the eye against germs and debris. There are 6 different layers of the cornea. When the doctor is looking at the cornea, we're looking at like the epithelial, endothelial, your stromal layer, your Bowman's membrane, and so the different specialties. There's different diseases along the different layers of that cornea. With the cornea, common conditions that you might see often are abrasions, lacerations, pretty common. Your cornea is actually very good at healing itself. So usually with those type of injuries to the eye, the cornea just needs a few drops or lubricating drops, and the cornea will typically heal itself. There are more bigger injuries like an open globe, which is literally the eye. The eye itself has a deep laceration, which does require surgery. Sometimes we put a bandage contact lens over the eye to help with that, with a laceration. And also another common condition with the cornea is called keratoconus, which is actually the cornea is shaping out like a cone. So usually you can do cornea cross-linking surgery, but it typically can just be helped with contact lenses, hard contact lenses or soft contact lenses, depending on the severity of the keratoconus. With the keratoconus, we are looking at astigmatism, and I promise astigmatism is not a condition or a disease or anything like that. People often hear that and get nervous, but it's just the basic shape of your cornea. So an eye with astigmatism is kind of like a football, the shape of a football cut in half, whereas an eye without astigmatism is just like a soccer ball or basketball cut in half, a nice round curve. More that often than not, eyes have some degree of astigmatism. But with that keratoconus, that astigmatism just gets worse to a point that even sometimes a corneal transplant is needed. For the lens adjusts the shape. The lens itself adjusts its shape to allow for near and distance vision, which is what we call accommodation. As we age, it's a completely normal process. It affects the lens because the lens loses its elasticity and the ability to focus on nearby objects, which is what we call presbyopia. So typically between ages 40 and 50, you'll start to realize that reading glasses may be necessary, and that is a complete normal aging process, and we all will get that. So the retina, there's multiple different parts. The first part that we look at is the macula, which on a photo would look like a dark black spot right in the middle of your eyeball. It's just the small spot that allows you to see clearly. So it's what gives you your central vision. Your fovea is the sharpest point of focus in your vision, and your retina is also responsible for your night vision, which is the rods in the back of the eye, and your color vision, which is the cones in the back of the eye. So your optic nerve is at the back of the eye. It's what sends signals to the brain for interpretation. So the retina is kind of like the camera where it takes that photo, but the optic nerve is like the cable that you would connect to your computer from your camera. So it carries those signals that are in the retina to the brain, which is what the final product is. The retina's main artery and vein is located inside the optic disc. Um, the optic disc is also responsible for your physiological blind spot because it lacks visual receptors. So when we do visual field tests or confrontational visual fields, there is a spot within everyone's vision called your physiological blind spot, where is due to the lack of visual receptors in your optic nerve. So when we talk about your optic nerve and your disc, we're looking at the cup to disc ratio. So the disc itself is the nerve that you see at the back of a photo. So you see a nice round spot at the back of the eye with all these veins and vessels coming out of it. That's your disc. Inside is your cup. It's a nice circle. It's a depression is what we call, but it is in photos, it looks like a little bright light blob, I would guess you would say. We look at that when we're looking at optic nerve diseases such as glaucoma. We like to think of it as a donut, and I'm not sure if anyone's ever heard a doctor talk about that, but they talk about the size of the donut to the donut hole. The littler the cup is in the donut, the more you get to eat, the more vision that you might have. The bigger the hole is, which is the cup, the less donut you get to eat and the less vision that you may have. So I'm just going to review some common eye diseases. So eye diseases and conditions can affect your vision and overall eye health. Some conditions develop gradually and some appear suddenly. So a really common one is a cataract. It's a normal aging process. We all can get cataracts. Some are born with cataracts or trauma due to accidents. And cataracts also form quicker when you're out in the sun a lot and not wearing protective glasses. And also diabetes or smoking can cause cataracts to form quicker. So the cataract is a protein buildup of the lens, which leads to the cloudy vision. We often describe this as a dirty windshield. Symptoms include glare at night and blurred vision, not being able to see, the tiny scrolls on a TV screen, seeing road signs. Those are all common occurrences when we know that it's about time to get rid of those cataracts. Some people have cataracts and aren't bothered yet. And so at that point, insurance may not even cover the cataract removal if you're not symptomatic. The treatment for a cataract is surgery. It's one of the highest success rates of any type of surgery possible on the human body. It has about a 99% success rate. With the surgery, we break up the lens by the process called phacoemulsification, which uses ultrasound energy, breaks up that lens, and we put a little vacuum in there and it sucks it out. And then we replace it with a man-made lens. Once you have a cataract removed, you will never get another cataract. Sometimes you get a little bit of scar tissue over that man-made lens, and that's easily broken up with a quick office procedure, a quick laser. Usually there's no downtime or anything with the laser procedure. But after cataract surgery, you use drops for several weeks. You cannot lift usually over 10 pounds and no vigorous exercise or bending at the waist for 7 to 10 days after surgery. So it's a fairly easy healing process, and the surgery itself usually does not even require a stitch because your cornea heals itself so easily that no stitches are even needed for this procedure. Glaucoma and optic nerve conditions. So glaucoma is one of the most popular conditions to the optic nerve. This is normally due to damage to the optic nerve due to the interocular pressure, also known as the IOP in the back of the eye. So that pressure builds up, has nowhere to go, that fluid has nowhere to escape, and it causes damage to that optic nerve. Okay. Glaucoma is often considered the silent thief of vision. This is because it's often not even noticeable to someone until it's almost too late, because it's a gradual loss of your peripheral vision. This is why regular routine eye exams are important. Everyone has a targeted pressure that the doctor is going to want to keep your ideal pressure at. We base that off of your corneal thickness, because when we're measuring your pressure, the more pressure we put on the eye, because if your cornea is really thick, it's going to skew those numbers and make it seem like your pressure is higher than what it is. We look at that cup to disc ratio, like I mentioned before. We look at your visual field, which is a test that we do. We call it the sparkle test, where we check to see if there's any loss of your peripheral vision. And we check your, and again, your pressures, and your OCT, which is your optical tomography test, which is kind of like an ultrasound, a non-contact ultrasound of the back of the eye. So we look at the different layers to see how thin that optic nerve is. And with those measurements, those 5 different measurements that we take into consideration, we make the best target pressure based for you. Treatment and recommendations are often starting with eye drops. There's different types of eye drops. Most people start with just once a day, depending, and sometimes patients have to take 4 to 5 different drops several times throughout the day to keep that pressure lower. If drops aren't the easiest for you, we usually can do a laser surgery, which stimulates that drainage system like I was talking about, so that that fluid in the back of the eye has places to move around, and keep that that intraocular pressure at balance. That takes about 6 to 8 weeks to take effect, and you can typically only do those type of lasers twice. And it has like about a 70% success rate, and it all depends on how far the glaucoma has progressed, how healthy your eye is, and those different things. And then finally, usually the last solution is glaucoma surgery. This includes putting little stents into the drainage system to help the flow. Man-made, so the doctors can make their own types of valves, and then there's also other kind of stents that they can put into the eye. Our glaucoma doctor likes to say that you guys will become best friends. Patients will become best friends with her after surgery, because you're in here frequently until we can get that pressure stabilized after the glaucoma surgery. Other optic nerve conditions include the ischemic optic neuropathy, which is a sudden loss of vision due to the disruption of blood in your flow to the optic nerve. While there's no cure for the loss of vision, if you have ischemic optic neuropathy attack, you can use high dose steroids to prevent further inflammation and further vision loss. If you have a non-arteritic ischemic optic neuropathy, unfortunately, there is no treatment at this time. There's also the optic atrophy, which is a chronic lack of blood flow to your optic nerve, which makes that nerve shrink. Your macular degeneration and other retinal conditions. Most commonly, again, is the macular degeneration. There's 2 different types of macular degeneration. There's dry AMD and wet AMD. Both cause damage to the macula. The dry AMD is the most common. It creates small yellow deposits onto the macula, which are called drusen, and those drusen build up, which make the vision blurry and distorted. The wet macular degeneration is an abnormal growth of blood vessels underneath the retina and they start to leak fluid or blood. Most symptoms are blurred vision with either one of these conditions. Treatment and recommendations include lifestyle changes. Like if you're smoking, we recommend to stop smoking and eating leafy greens. There are vitamins called AREDs that we recommend. And we also, for wet AMD, can do injections, which are called anti-VEGF injections into the eye. There's several different types that you can inject into the back of the eye. Usually we'll send a patient home with an Amsler grid, which is a black and white tight grid that we recommend putting on your refrigerator, covering an eye at least once a week, going back and forth, and making sure that at all times you can see all four corners of that Amsler grid, making sure that those grid lines are straight and that nothing is missing within that grid. There's no empty spots. If there's any changes to that, that's when we recommend that you call your ophthalmologist immediately and have this checked out. Other common retinal conditions is a macular hole, which is just a hole in the macula that's often fixed with a type of macular surgery where they do a membrane peel and fix that hole. There's also a macular pucker, which is what we also call a wrinkle in the back of the eye or an epiretinal membrane. Pretty common as we age. And then again, retinal detachments and retinal tears. So the retinal detachments is the jelly-like substance, the vitreous that I was talking about earlier. As that liquefies, it starts tugging on that retina, and sometimes it tugs too hard that it pulls the retina with it. It's more common in eyes that are long, so your high myopic nearsightedness patients, because that eye is so thin, that there's not as much jelly to fill that eye. Common signs and symptoms that we always ask patients for is sudden loss of vision or a spot of loss of vision, spider webs, so if you're seeing cobwebs in your vision, a veil or a curtain over the eye, and lots of flashes and floaters. Some floaters are completely normal. I have them. Most people have them. They're just like little black spots that you kind of think are a mosquito going around, but I'm talking about like hundreds of floaters or flashing lights like fireworks. It's immediately when you want to call your physician and get your eyes dilated for an exam. The next common eye disease is called diabetic retinopathy. This is when high blood sugar causes damage to the retinal vessels. So we typically talk about how the eye is actually one of the first places that you will see damage from diabetes because the vessels are so small. So we kind of think of it like a tree to the twigs. The twigs start to show the smaller vessels are what's affected first. So this is bleeding in the back of the eye. Symptoms include blurred vision, floaters, vision loss, or often I hear people say that they see like blood in the back of the eye. On this screen here, I have a picture of a fundus photo, so the back of the eye of an eye with diabetic retinopathy. In the eye, you'll see lots of micro hemorrhages of blood throughout the eye and some even large hemorrhages in the back of the eye due to the diabetes. And below the photo of the fundus, I have, again, the OCT is what we look at as clinicians to determine the amount of swelling that is in the back of the eye due to the diabetes. So number one treatment recommendation is blood sugar control. Smoking can also cause your diabetic retinopathy to increase. We recommend yearly eye exams for diabetics. And if you do have diabetic retinopathy, some of it is cured on its own with these simple like blood sugar control. But more extreme times, laser therapy and injections are needed. So the same injections that we would use for wet macular degeneration, we would use as well for diabetic retinopathy. Another common condition is called amblyopia and strabismus. You often hear strabismus being called like a lazy eye, where in fact is what we consider amblyopia. So amblyopia is when one eye doesn't develop normal vision because the brain favors the other eye. There's no rhyme or reason to it. Nothing that anybody did wrong. It's just your brain favors one eye over the other. My son personally has this, my youngest, and we caught it at when he was 2 years old. So, like most kids, we now patch his eye, his good eye, actually, 2 to 3 hours a day to help strengthen the weaker eye, and get the brain used to using that eye. So we usually use glasses, patching, or there's even a drop called atropine, which is a very strong dilation drop that will keep your eye dilated for up to 7 days. And again, we'll put that atropine drop into your good eye to help the weaker eye practice seeing. So the strabismus is what we call the crossed eye or the wandering eye. It's when the eyes don't line up properly. So whether an eye turns in, up, out, or down, and the other eye remains straight. So there's 6 eye muscles in the eye, 6 ocular muscles. So it's when those muscles are not working well together, that this is usually glasses. Again, glasses can help with this, but it often causes double vision, which we call diplopia. And prisms are sometimes needed to help align the eye and help with the diplopia. It also causes amblyopia. But it's often treated with surgical intervention where the doctors will manipulate one of the 6 muscles to get your eye aligned correctly. It will help with double vision. Another common occurrence is dry eyes. In New England, dry eyes is very common, especially with AC blowing at you during the summer and the dry heat during the winter. It's when your eyes don't produce enough tears or your tears evaporate too quickly. Believe it or not, a common symptom of dry eyes is tearing. It's because your body is overproducing all those tears to try to keep your eye lubricated. So tears pour out. Discomfort, irritation, vision distortion, redness, and a little bit of light sensitivity, which we call photophobia. Simple treatment and recommendations is artificial tears. We typically don't recommend artificial tears that say things like get the red out because you have a rebound effect with those. So things like preservative-free artificial tears are what we recommend. And you can use those anywhere between 4 to 8 times a day to keep your eye lubricated. If those artificial tears over the counter don't work, there's prescription drops like Restasis and Xiidra. And lifestyle changes, so omega-3s, fish oil, we typically recommend that as well. Those take a little bit longer to build up in the system, but those also help with dryness. No smoking, and there's also things that's called punctal plugs that we can put in your punctum. So think of it like a shower stopper in your shower when you're trying to do a bath. We're putting a stopper over your punctum to avoid the tears evaporating so quickly and going through the drainage system. There's temporary ones and there are what we call permanent ones, but they can always be removed. It's an in-office procedure. Optometrists and ophthalmologists can do those for you. There's also lasers that you can do. Typically, insurance does not cover those, but there are lasers that can be used to treat dry eyes.
So,
And then,
Michelle, sorry, we had a question. What is geographic atrophy?
So geographic atrophy is in the retina. So it is usually you see it in macular degeneration. It's kind of like those drusen in the back of the eye. I'm trying to figure out how to explain it. There are injections now for geographic atrophy to help prevent how the development of macular degeneration. So it's the loss of retinal cells in the retina is how we describe geographic atrophy. Not sure if that helps answer the question or not. Usually it's caused by, again, smoking, genetics, aging, and you normally notice the central vision loss when you start to notice the symptoms of geographic atrophy. So with the dry eyes, we also recommend lid and eye hygiene. This can be done with baby shampoo. You dilute it and clean the lids of your eye. Often that helps opens up the glands, keeps the eye from overproducing or draining too much of those tears. And then another common one that we see frequently is conjunctivitis. So not all conjunctivitis is contagious. There's viral, bacterial, and allergic. Allergic is not contagious. I have chronic allergic conjunctivitis. So usually this is when the pollen is irritating my eyes. My dogs are irritating my eyes. It is inflammation to the conjunctiva. And the conjunctiva is a thin, transparent membrane that covers the inner surface of the eyelid and the white part of the eyeball, which is what we call the sclera. It protects the eye from irritation and infection by providing a smooth, moist surface and producing the mucus. It's also richly vascularized, so it provides oxygen and nutrients to the eye. Common signs and symptoms of conjunctivitis are redness, itchy eyes, discharge, which could often color, thick discharge. Depending on the type of conjunctivitis, like if it's viral, there's nothing we can do. Just keep your eyes clean, good hand hygiene, avoiding rubbing your eyes, changing your towels out. Try not to touch any surfaces after touching your eye. If it's bacterial, we can prescribe antibiotic drops. And for the allergic conjunctivitis, it's normally treated with allergy drops. So often like drops like Pataday, Patanol, Aloe, things that you can get over the counter as well. For prevention for a lot of these conditions, we recommend regular eye exams, yearly eye exams, especially over the age of 40. A healthy diet, omega-3s and vitamin A, proper eye hygiene, which again is just making sure that your lids are clean, wearing sunglasses. Wearing sunglasses will help prevent the early onset of cataracts. It also prevents growths on the cornea called pterygiums or pinguiculas. But most importantly is managing chronic conditions such as like high blood pressure and diabetes. And that's what I
For more
have for
information,
today.
contact Jerry Feliz, Access Technology Director. Phone number 857-443-6636. Email jfeliz@mapcommunity.org. Thank you so much for watching.